Hi everyone, it's Faheem, pharmacist, prescriber, contractor and founder of Medlearn. In this video, I'm going to be explaining to you right from the start to the end on how you fill out an application form if you're looking to become an independent prescriber. Now, before we go any further, as you know with YouTube, I'd always invite you to subscribe, like, and share my YouTube channel. This content is specifically being made for you, so please do let us know and join part of our community and let's help build a better world. So let's move into the application itself. Now, before I actually start to go through in the nitty-gritty, I want you to understand that this application I'm showing you here is an overview, but also a generalization of applications. Each application or each university that you go to will have some subtle differences. So I want you to keep that in mind, that there will be subtle differences, but the concepts are exactly the same. So let's move on to it. I'm just looking at my screen, so it'll give me some pointers in terms of what I need to tell you. Now, this particular application, the first section that they're after is your personal details. Again, that's fairly straightforward. Your name, address, contact number, email, and so on. So that's going to be very, very important. Make sure that's accurate and that's correct because that needs to be right. Another thing that they're going to ask you is about your profession. Are you a pharmacist? Are you a nurse? Are you an allied healthcare professional? And what is your professional PIN? And if you're a pharmacist, that's your GPHC number. If you're a nurse, that would be your NMC number. So that's important for you to remember as well. Once we've done that, we can move on to section 2. And this is all about the professional eligibility. So each application will always have section 1, which tends to be about yourself, your name, your address, and so on. Section 2 tends to go and dive into a bit more about yourself and looks for your professional qualifications. And here they may ask for your certificate of your degree. They may also ask any postgraduate qualification you've done. So as a pharmacist, there might be any learning that you've done with CPPE, or maybe there's learning that you've done, for example, vaccinations, working at a COVID center, whatever qualifications you have, they're going to want to know that in this section. They're also going to want to know in terms of your area of practice, your scope of practice. So which area are you looking to develop your practice in? And a bit about your scope of practice, you have to make sure that it's narrow enough, that it's specific, but not too narrow that it limits you. And I'm going to give you an example of a scope of practice that might be quite useful. And that might be something like hypertension. So hypertension, you may write that I want to develop my skills in hypertension, stages 1, 2, and 3. For those presenting, let's say, over the age of 45, I'm just making this up, and have no comorbidities. When you're choosing your scope of practice, folks, it's really important for you to understand that you have to choose your scope depending on which area you're going to be seeing patients in. And I explain this to my students all the time. If you're a community pharmacist, hypertension, diabetes, asthma may not be the best choice for you. Why? Because you're not going to be able to do, for example, spirometry for diagnosing asthma. You're not going to be able to do full blood counts for diagnosing somebody with diabetes, or if you're looking for end organ damage and doing ECGs for hypertension. So maybe this might not be the best choice for you, but if you're working a GP practice, then it's very useful for you. But in community pharmacy, you might want to go with minor illnesses, for example, treating a UTI. And you might say, actually, I want to develop my skills in treating uncomplicated patients above the age of 18 who have UTI symptoms and are systemically well. You might also choose, I want to choose children above the age of 6 all the way up to 65 presenting with a sore throat who are systemically well with no comorbidities. That might be useful for you. Or maybe you can do something like a cough. So your area has to be very, very specific. And folks, it's important for you to remember that the area that you're developing your scope of practice in, you must have the clinical skills training. When we look at the application form, the universities will want you to have some sort of reference or someone to vouch for you that this individual who's applying is clinically competent. That is because the universities or this course is a prescribing course. It is not a clinical decision-making course or a course teaching you how to fully diagnose, manage, and treat disease. It is designed to teach you to prescribe. Yes, there are elements of clinical skills training, but it's nowhere near the depth that you need to have to diagnose, manage, and treat. So let's summarize. We've spoken about section 1, and that is about yourself and your information. Section 2 starts to go into the professional eligibility. They're going to want to know your GPHC number. They're going to want to know when you qualified. They're going to want to know your past experiences. So CV becomes quite important. Where have you worked? What sort of activities have you carried out? Talk about COVID vaccinations if you've done them, talk about flu vaccinations, talk about travel vaccinations, talk about CPCS, talk about minor illnesses, talk about working with PGDs. All of this is very, very important. Another thing that they might ask you is, how do you undertake your consultations? And here you need to mention to your patients, rather those individuals who are going to be looking at your application, so not your patients, but you want to mention to those who are going to be looking at your application that you undertake a full history. You document properly. You examine where you need to examine. And I'm going to give you an example and tell you now, folks, you are all examining all the time. When you have a patient who presents over the counter with, for example, conjunctivitis, you're examining the eyes. When you have a patient who presents with a sore throat, some of you are looking inside the mouth. So you do examine. It might be on a very limited scale, but you are examining all the time. So talk about how you do your consultation. You take a thorough history. You document. You examine where appropriate. If a patient is not legible to be treated by you, you refer. You should be sending referral letters out to the GP. You should be doing follow-up. So these are all important parts. And I would say in all your consultations, if you're not trained on how to undertake a consultation properly, get in touch with us at Medlearn. We're more than happy to help you. But you should be taking thorough history. You should be documenting. You should be examining the patient where appropriate. You should be referring patients with a referral letter. You should be also following up with your patient and reflecting on every single case that you have where you can. Again, the universities want to hear this. So let's move a bit further down. So again, they're going to ask for your professional qualifications. What did you qualify with? And to be honest, whether you qualified with a 3rd class degree or a 2nd class or 2-1, it doesn't really rule you out in terms of, or rule you in terms of doing your prescribing. So don't worry about it too much. Everybody's legible as long as you're a pharmacist and you have the clinical skills training. They may also ask for some supporting information. And here it talks about any sort of professional experience that may help facilitate your prescribing. So maybe you've carried out some work experience at a GP practice. Maybe you've done other services, as I mentioned to you, like flu vaccination, travel vaccinations, CPCS, or maybe you're carrying out diabetes screening, hypertension screening. So you need to mention these things. As we start to move further down, the next section talks about if you've completed a health or clinical assessment course. So the universities want to know that, do you have the clinical skills? The universities want to know, do you have the knowledge? Because this course is not designed to teach you clinical skills. It's designed to teach you how to prescribe. So all the governance around prescribing, legals, ethics, frameworks, consultation models, making sure you're aligned with the RPS framework for prescribers. So this course is not designed to teach you clinical skills. That's why they're asking, have you ever done clinical skills training? And if you haven't done clinical skills training, do you have somebody who can vouch for you? Again, very, very important. Do you have someone who can vouch for you? That might be your line manager, that might be a supervisor, but someone has to declare that you are clinically competent. Otherwise, you shouldn't be doing this course. And let me outline, folks, this course is designed to teach you to prescribe, not to teach you clinical skills. Keep that in mind. This course is not designed to teach you clinical skills. So you need to make sure that you already have them in place, or somebody can actually vouch for you or declare that you are clinically competent. So far what we discussed. Part number 1, your details. Part number 2, professional legibility. Part number 3 is talking about your professional experience and also having clinical skills. Then the universities will also want to know about your reasons for applying in the prescribing course. What benefits are there to the NHS? What benefits are there to your employer? What benefits are there to you? So you can talk about things like improving access to healthcare. You can talk about things like reducing the burden on GPs. You can talk about in syncing yourself with the vision of the NHS. You can talk about uplifting our profession. You can talk about how it's going to benefit your pharmacy by, again, uplifting our professional, you growing professionally, you being more motivated, but also introducing new and innovative services. They may also ask you, well, actually, fair enough, if that's the case, then, provide us details about, and in this case, why you want to prescribe in your area, what's going to be the benefits to the locality and the patients. So again, you need to be prepared to talk about this. As I mentioned to you, benefit to your organization. And again, new services, innovative, professionally growing, motivated, increasing or uplifting our profession, improving our image towards the public, and so on. Then there's going to be another section about your DMP and your DPP. Now, the word DPP stands for Designated Prescribing Practitioner. The word DMP stands for Designated Medical Practitioner. They're both synonymously used now, so don't think about it too much. They both mean the same thing. But I want to point something out. If you're struggling to find a DMP, get in touch with us at Medlearn, we can help you. If you do have a DMP, please make sure that this DMP or DPP is there to support you through your qualification and afterwards. And I get so many students getting in touch because their DPP isn't actually aware of what's required. Their DPP doesn't know how much workload is required. The DPP is not been informed. So some students are just looking for a quick fix, and there is no quick fix. Nowadays, the universities will also interview your DPP. That does he have the experience? Is he willing to support you? And you need to think about it. You're giving your time, and time is value. Time is an asset, and it's never coming back. So there's no use for you to find someone to supervise you just for 90 hours. This person should be supporting you for more than 90 hours. This person should be actively involved in gaining your prescribing qualification, teaching you where he needs to, relevant anatomy, physiology, pathophysiology, helping you take a history, helping you examine, helping you with the university courses, supporting you, motivating, encouraging you, teaching you so you can observe, but also then he can observe you practice. There's no use you sitting in a quiet room and no one there to allow you to practice, and all you're doing is observing. So make sure the DPP that you go with, ask them, 1, do you have an experience teaching pharmacists or whichever profession it might be? 2, do you have some sort of structure in place that you're going to have to teach me? 3, how will you support me? 4, are you going to be there for me afterwards? If this is not the case, please don't waste your time. That's important to remember. So in this section, they're going to ask the DPP, what experience do you have? Have you taught before? Your qualification, your scope of practice, do you keep up to date? How will you support the student? So that's what this section is. Afterwards, your line manager. If you're a locum, you need to find a line manager. If you're employed, you need to have a line manager. Somebody has to vouch for you. Somebody has to support you. Again, very, very important to remember that you have to have some sort of support network. And there should be a prescribing lead within your organization if you are looking to prescribe. And they need to also declare that they're willing to support you, you're clinically competent, and they will give you all the necessary tools and resources that are required for you to get your qualification. Now, as we start to move down, again, more information for the GP. Where's he working? What's his address? And so on. And then if you're self-employed, there's going to be information about who's going to fund your course, a bit about NHS funding as of now. It's January 2023. HEE or NHS funding for pharmacists is ending in March 2023. Right now, we don't know if there's more funding available, so you may or may not be able to get that funding place. Keep that in mind. Afterwards, they're going to be talking about the student agreement. And once you've done that, that is pretty much your application. So, information about yourself. 2, your professional eligibility. 3, your personal statement. And this is where you're going to talk about everything about you. Why you want to become a prescriber. You're in-syncing yourself with the vision of the NHS. There's a shortage of doctors. There's 2.8 doctors to 1,000 people in England. NHS waiting times have not been hit. Burden on GPs. Pharmacists have the capacity to be able to prescribe with the right support network, so you want to do it. Then talk a bit about yourself. You qualified from X university for how long? What have you been doing? I've been doing CPCS. I've been doing vaccinations. I've been doing travel vaccinations. I've been doing diabetes screening, hypertension screening. I take thorough histories. I examine. I document. I reflect. I refer. Important. Then move on to your scope of practice. What do you do in your scope of practice? Tell them when you have a patient with a sore throat, you diagnose, you think about the fever pain score, you practice evidence-based medicine, you document properly, you examine to make sure that there are no referral criteria there. So that's going to be very, very important for you. Then also about the university. Why do you want to attend that university? Maybe you've already been there and you're an ex-alumni. Maybe they've got great resources or a research area and so on. So that's going to be important. Once you've done that, you're then going to get your DPP details and make sure you make it clear that your DPP has to play an active role. It is not good enough for your DPP just to allow you to observe. Your DPP should be supporting you, helping you build a network, teaching you, allowing you to observe. You should be supervised then. Case-based discussions, helping you with exams, essay writing, portfolio, and so on. Once you've done that, you then can move on to the doctor's detail, a few signatures, and so on. University will ask for 2 references, normally 1 academic and 1 professional. Universities may also ask for copies of your university qualification. University will also require you to be having a enhanced DBS. So make sure your DBS is in check and you have enhanced. And this is a bit about the application form. It's not difficult, folks. You've done it before. Any support you need, get in touch with us at Medlearn. Subscribe, like, and share this channel and make the best use of your time. Uplift our profession, help the NHS, and together let's build a better world. Thank you for watching. Thank you for listening. Now, before we go any further, as you know with YouTube, I'd always invite you to subscribe, like, and share my YouTube channel. This content is specifically being made for you, so please do let us know and join part of our community, and let's help build a better world.